So you have a cold and you're pregnant. This is Mavis Shorn, professor and nurse midwife at Vanderbilt University School of Nursing, and I'll give you a few suggestions. Having a cold in pregnancy is just not much fun. You already have some changes in pregnancy that make a cold even harder to deal with. It's just the swollen mucous membranes you already have just from being pregnant. So it sort of aggravates. It's even a little bit more difficult to deal with. But there are things that you can do. Remember that Tylenol is one medication that you can take in pregnant, that you're not going to take aspirin and you're not going to take Motrin or ibuprofen. There are a lot of comfort things. It's really a cold. We know you can't make it go away. You're just going to treat the symptoms, right? So you're going to do things like you can gargle with some warm water. You can use throat lozenges. Even those cough drops to suck on are okay. You can use a saline nasal drainage, a nasal flush. It's called a neti pot. Get lots of rest and fluids and give it time, and it will go away. Antihistamines can be taken in pregnancy. Really would prefer not to recommend those in the first trimester until a little bit later. If you feel like you really need an antihistamine because you just cannot sleep or you cannot function at work or in your daily activities, talk to your healthcare provider about which one to use. If you have a cough that just doesn't go away or is progressively worse, if your drainage, your nasal drainage, or you're starting to cough up stuff that's yellow or green, or if you start running a high fever, those are also things that you need to talk to your healthcare provider about.